Hello, and welcome to the Nursing Economics podcast series. This series will provide extended content relating to articles published in the journal, such as author interviews and roundtable discussions. On October 6, 2017, Nursing Economics editor Dr. Donna Nickitas talked with nurse and acclaimed healthcare economist Dr. Peter Buerhaus about study findings published in the November-December 2017 issue of Nursing Economics. The article, entitled Improving Nursing Workforce Forecasts, Comparative Analysis of the Cohort Supply Model and the Health Workforce Simulation Model, was co-authored by Buerhaus and Drs. David I. Auerbach, Aprita Chattopadhyay, George Zangaro, and Douglas O. Staiger. In this article, a meeting of the nation's experts on modeling the supply and demand for nurses was held to better understand and reconcile underlying model differences and discuss communication, messaging, and other strategies around workforce forecasts. Results of a comparative analysis between the Cohort Supply Model and the Health Workforce Simulation Model are reported. Key factors that workforce analysts should monitor to anticipate changes in the future size of the nation's nursing workforce are identified, and modifications are suggested. During his discussion with Dr. Nickitas, Dr. Buerhaus provides a balanced review of the influence and expectations of these two models within the nursing workforce, and expands upon how the meeting of experts was organized. He further talks about the importance of leading by example and the care taken when attempting to forecast nursing's future, which is predictive, not precision. We are pleased to present their conversation here as the premiere episode of our podcast series.
This is Nursing Economics. I'm pleased to provide this podcast on nursing workforce, and I am Donna Nickitas, the editor of Nursing Economics, the Journal for Healthcare Leaders. My guest today is Dr. Peter Buerhaus. Peter is the director for the Center for Interdisciplinary Healthcare Workforce Studies, the College of Nursing at Montana State University, Bozeman, Montana. Peter, welcome. We're delighted to have you as our guest today. And I'd like to begin here by asking you to tell us about the two leading forecasters for nursing workforce, Health Services Research Administration, HRSA, and the Montana State University Center of Healthcare Workforce Studies. How did you decide to come together to tackle and rectify or reconcile these different models? How did it happen and why?
Hey, Donna, good morning, and thank you for the opportunity to talk with you. That's a big question, and there's probably a bit of an answer here to that. So I think there's 3 or 4 points that lead up to this addressing fully your answer. And I'd begin by saying that over my career, I've given a number of presentations to a wide variety of audiences, including healthcare CEOs, chief nurse executives, nursing educators, and I received many inquiries throughout the year from Wall Street analysts who are interacting with hospital and healthcare systems about the workforces in nursing and physicians, and a lot of discussion with companies that supply temporary and traveling nurses. And I also talked to the media. And in almost every one of those sort of situations, the topic of nursing shortages are raised. And so I try to give a full and accurate and balanced answer to that question. And I talk about the results of the cohort model that my team, David Auerbach and Doug Staiger, and I have been using for almost 20 years. I also talk about the results of other forecasters, particularly the model used by the Health Resources and Services Administration, which I'll just say is call it HRSA. Mm-hmm. And they have been working on the Center for Workforce Analysis at HRSA, has been producing estimates of the supply and demand for nurses as well. So I give the audience the full, picture of what these models are, but it turns out that our model, the cohort model, and HRSA's model have not agreed most of the time on the supply side of the forecasting. And so this lack of agreement has caused confusion, it's caused uncertainty, and it causes frustration when you're talking to people because they want to know, where are we going? Because they have to plan for the future. They have to use resources. They have to not use resources in other places to shuttle those resources where they could be best used. And they would like to know, what are we planning for? And we haven't been able to give them that. So, and I think that tension, that frustration is increased as we've had this uncertainty over health reform. It has brought so many different changes into healthcare that people need more certainty, at least on their workforce, rather than less. So this has been building up. So that's sort of the first thing. The second thing I'd say is, in 2013, I received a grant from the Gordon and Betty Moore Foundation, which was to support my workforce center. And one of the obligations of the grant was to bring parties together to resolve important problems that affect the nursing workforce. Okay. Well, it took a little while, but eventually it dawned on me that the center should organize a meeting of the leading nursing workforce analysts and modelers in the country to meet, to see if we could roll up our sleeves, talk with each other, work together, and find ways that we could improve our forecasting. So that sort of was in my mind, but when I moved to Montana, I realized that it might be possible to give these analysts and forecasters a good opportunity to come to Montana. You know, Donna, maybe you did this when you were a little girl. You were out in Yellowstone, or maybe in your hippie days, Donna, you drove across the state and things like that. But there's a maybe a possibility that going to Montana might be attractive. And I could get people away out of their environment, give them a beautiful scenery, inspiring views of mountains, and the time needed to just really roll up our sleeves and work at this. This is not easy kind of work. And so I decided that's what we would do. So in the process of organizing this meeting, I reached out to a colleague, George Zangaro. George is the director of HRSA's Center for Workforce Analysis. And I discussed the opportunity with George to see if he would be interested in coming and to bring his team to the meeting. And George was enthusiastic about this idea, and in fact urged me to even apply for a grant at HRSA to see if I could get some additional resources to fund the forecasting meeting in Montana. And that's what I did, and I actually did get the grant, which was very, very helpful. Yeah. So I had known George for several years, and we had talked about the cohort model, HRSA's model, and not in great depth of the details of our model, but we often sort of, we understood each other's frustrations of modeling and what that involves.
Terrific. So what else worried you about this modeling conversation when you started to negotiate with George?
Well, I think our frustration.
Frustration, more than worry.
We do our best to get these forecasts. We are careful in our wording when we write these manuscripts.
Okay.
And so that we don't overstate a result or lead people in the wrong direction. But it seems that George experiences this, we've experienced this. People want a lot of exactness in these forecasts. They want to know what year, where, how many, in their town, in their state, in their institution, and they want to know the number, not just a range. And it's not possible to do that. Even if we had perfect data, perfect models, everything, life changes. There's so many different things that occur to disrupt that. It's not unlike forecasting a hurricane. You see those broad cones out there that they say, well, it could go this way, it could go this way. Well, there's so many factors that occur that move the actual hurricane, and then the intensity of that hurricane, the wind speeds, the rainfall, all those things are in play. But yet people feel, and I'm not criticizing people, I would want that too.
Right.
But it's hard to then communicate the proper messaging so people understand what we're saying.
So what you're saying is forecasting is predictive. It's not precision.
Right.
And that's what sometimes I think you're saying in terms about the frustration as people interpret your forecasting models.
Yeah.
They want exactness, and you can't give them that all the time.
Right. The other frustration, Donna, just to be really honest with you, is I think George and I have grown up in a world where people are used to shortages of nurses. Everybody assumes a shortage of nurses. And if you issue a forecast that says it may not be a shortage, there may be a small shortage, or there could be, we're in balance, or maybe even a surplus of nurses, people are not necessarily interested in hearing that. There seems to be this built-in, I want to hear about a shortage. And so it makes it a little bit more challenging to then say to people, it may not be that way. And it causes, I think, people to sort of get out of their mindset and realize that now maybe they have to adjust to a different situation. And they're not comfortable with that. They're familiar with shortages. They're not familiar maybe with something else. So that comes into play. And it can sometimes be get back to us in unpleasant ways.
Okay.
So that's what we were talking about, and the frustrations. But so I think George and I had both sort of encountered those frustrations. But I was really, really happy that George brought Aprita, his chief person at HRSA, and Tim Dahl, who manages a lot of the contract work that builds the models and works closely with HRSA. Tim and Aprita both came to the meeting. And I think that being out in Montana, away from the city, in the country, and in the mountains, it was a chance to get to know each other. We all sort of knew each other, but not really well. And you find out things when you're having a drink at the bar, or you're out on a walk, a hike together, and it helps sort of lower tensions and creates a good feeling.
Community of trust.
Exactly. And I think that's an important point, the trust. Because what happened is, in the meeting, we started to examine our models. And it became very, very clear that we were going to need more time. There's too many things going on in both the Montana model and the cohort model. But what happened is, I think our curiosity got piqued, because I would hear Tim say something or Aprita say something, and I go, I didn't see that. I'm curious about that. And I would see them raise their eyebrows or exchange a look and say, what they just talked about, the cohort model, surprises me. So I could see some growing curiosity developing. Now,
so that's a really good transition, Peter, because my next question to you was to continue on that point of those expectations. So go ahead.
That's a great piece, because I know I had to do the following. I was very confident about our cohort model. We'd worked with this for 18, 19 years. We have had this model peer-reviewed by experts at least half a dozen times. We've tweaked it, we've built assumptions, we've tested, we've done everything possible to really try to get it right. And so I had a lot of confidence in our model. But I had to step back and say, but honestly, do I know everything about that model? And I don't. I know much about that model, but I don't actually run the numbers, make some critical decisions along the way. I know where there is some limitations, but Dave runs this model for us. And so I know there were some sort of gray areas in this piece. So I had to realize that, maybe there is room for improvement. Maybe there is some things that we could do better on our model. And I think the folks at HRSA had to probably come to understand that this isn't about defending our model. This is about learning more about our model, learning about their model, and maybe there's something that we could both do better to improve our forecast. So there was a bit of look in the mirror and realize what we're here about and listen, and that. So I felt like, in a way, we had the European model and the American model, and we were,
even though you're all in the same country.
Yeah, even though we were in the same country, and even we were forecasting. We weren't forecasting hurricanes, but we were forecasting the nursing workforce. This is a bit of a hurricane, but it was these two models, and you see them on TV, and the European says the hurricane's going this way, the American says this way, and it's like, well, where's this thing going?
Right.
And that's sort of what we were looking at. And I think we realized that maybe what we could do is we could narrow that cone of uncertainty. Okay. There would still be remaining uncertainty, but we could narrow that. And that was sort of, I think, a driving force that we both kind of came to. So we hope that by this process of mutual exchange, discussion, we would improve our own model, HRSA would improve their model, and oh, by the way, we might even get these two models to be more together and less variance between them, and that would be good news for all those people that I began this conversation talking about.
Excellent. Good. So let me ask you the next question. Describe, I think you already did this a little bit, but describe what you hope to achieve by the deliberations, and I think you mentioned that, but let me just ask you, did you have any preconceived ideas about the process? After all, you were talking to the federal government, and so much of what the government does is about big data and projections, forecasting as you described. So can you address, what you talked about bringing them to Montana, giving them clean air, clear skies. I'm sure that was magical in and of itself. But you did say, here we have two different ways of looking at the world.
Yeah.
We may or may not agree. So what were you thinking yourself, and then what you were thinking on behalf of your team?
Well, I have to give George Zangaro a lot of credit in this, because I had known George for a while. And in these conversations that we had, we're both nurses.
Okay.
And so I think George and I realized that these forecasts matters. They ultimately get down to the population, to patients, to staffing, to having enough nurses where we need them. And so we, I think, early agreed that we saw our contributions in maybe a different way than our other team members were seeing this, because we experienced that as a nurse. And I think we were able to put that as sort of maybe our top goal. Okay. This is what brought us together. We wanted to do better for that end user, to make life better for that nurse who's dealing with the patient. And I think that allowed us initially to feel trust in each other. We were able to do that. Now, having said all that, and as I mentioned before, I had a lot of confidence in our model, and I, was open certainly to change and improvement, but I was also aware that they better have some damn good reasons to change, because I felt strong about it. Mm-hmm. But I also realized they probably felt the same way. So I think we all had to step back and open our eyes and listen.
Right.
And I think that's what the answer is to your question.
Okay, so you came in with your own evidence as nurse scientists, recognizing that you need the evidence to generate the conversation. You trusted in the relationship, the ability to come to the table and deliberate. So that's important, because sometimes when you have wicked problems, the only way to get wicked solutions is to be able to learn to listen and trust implicitly in the process.
And I think the other part of it is we're academics too, and so publishing, and we have a little bit of a competitive nature to us, which is good, but you don't want it to get to the point where you don't listen and you don't hear, and that. So Yeah, I think
Okay.
that was good.
So we're at the point now where you can tell me about what were the lessons that you learned from each other, listening to what your both teams were presenting. What were the negotiations? What were the consensus? And as researchers and economists, how did you deliberate, so to speak?
Yeah, touched a little bit on this, but I think looking back, there's probably 4 or 5 things that were key.
Okay.
And I think, first of all, leadership. Leadership matters.
Absolutely.
And I'm not trying to draw attention to myself, but I think there was leadership on my part. There was leadership on George's part. Okay. We kept a bigger goal ahead of us, and we both had to sort of communicate to our teams that this is the big goal that we're looking at here. It's not about our team doing better than their team, or we're better than you, or it's not a win-lose situation. This is we together will all benefit from it. So we had to sort of lead by example, trust and listen to each other, and negotiate and make compromises. Mm-hmm. That set a tone to our team members that we expected the same. And so our team members, and I think in the process of being with each other, it was easier for Dave and Aprita and Tim and Doug and I to know each other better. We had something to talk about. We could trust. So trust is a second piece. I think you need to build trust when you're having these sticky problems, these wicked problems, as you call them. Right. Then I think curiosity matters, because the more you listen and learn, the more curious you get of not only their model, but, well, how would that look in our model? Right. If we did it that way, what would happen? Then I think good communications always matters. You just have to be able to look at each other and say, I don't get it. Would you please come back, try to explain it in a different way, because I'm not following you. This meeting and the subsequent conversations that we had gave us that time to say, yeah, okay, let me try it this way. We're not dummies, but this is complicated, and you don't always see it. So good communication matters. A last thing, Donna, and I want to say this to you, and thank you for this publication, because what became clear as we got going in this process of going back and forth and testing our assumptions and talking to each other and communicating is that, you know what, we're doing something that's important. We should try to get a publication. But we thought, who's going to publish this? Who would, in their right mind, publish a pretty technical, nerdy type of manuscript? But that was important, because otherwise it would just become a white paper sitting on somebody's shelf that collected dust. So I thank you for giving us this opportunity, because I think going forward, people will say, oh yeah, this issue is discussed in this paper. They recommend we do the following. So when we do this person who's doing forecasting, they are more likely to abide by those sort of guidelines, which makes it easier downstream to say, okay, they've done this and they've done this, so we've got to really look at this seriously. But if they go off and do this other direction, at least we know where they went and did something different. We can compare that and we can analyze that. So this paper, this publication is actually pretty important, and I appreciate you doing this.
And we are delighted to do it. Let me just remind our listeners that the paper that Peter is describing is the issue that is our November-December issue, and the topic, or the title of the paper, is Improving Nursing Workforce Forecasts, Comparative Analysis of the Cohort Supply Model and the Health Workforce Simulation Model. So thank you, Peter, for pointing that out.
Oh, by the way, that you just made me realize something. What we've been talking about is really the supply side of nursing.
That's right, and
we
not
haven't talked about the demand side, which is something that we agreed not to do. We wanted to just stick with supply. Supply was hard enough. Demand is really, really hard. We'll need a big conference for that one.
Absolutely.
But, so I just want to make sure we...
And I think that's important for our readership, many who are nurse academics like ourselves, nurse leaders in large health systems, nursing students. They need to understand, what the supply side means, what forecasting is, and it's all really, again, where you are, where you live, your local demographics. You want to have a better understanding, although you do that as well, and you've done that on a series of previous articles in nursing economics you've talked about those supply and demand issues both nationally and regionally. So let me just ask you another question as we proceed here. So what can employers, I just talked about myself, and academic or educators, and certainly policymakers expect from the forecasters, yourself included and HRSA team, going forward? What do you perceive will be our challenges, our conflicts, and what will future conversations look like?
Well, I hope that with this paper, that manuscript that's getting published, that there will be a little bit more uniformity around future forecasts, that everybody will define a full-time equivalent nurse the same way.
Okay.
So that way we eliminate one source of problems, because that actually matters we will hope that people will be very clear that, say, this is a forecast of nurses excluding advanced practice registered nurses. Our old model, our cohort model, used to put the advanced practice nurses in it. And, the interaction with HRSA made us realize, well, that's not helpful. We should do that separately.
Good.
So things like that, by reading this paper, people will sort of say, okay, let's go in these directions. So I hope that this will mean that future forecasts will have a narrower cone of uncertainty. We will always have that cone of uncertainty. But the value of like forecasting a hurricane, forecasting the workforce, is it gives you some direction. It says we're heading in this direction. This direction looks like a shortage or a surplus, or we're going to be okay. And when we can expect developments. And knowing that, then people, you and other leaders, can say, what does that mean for me? And I can prepare. And when you go back to 2000, when Doug and Dave and I published the article in the Journal of American Medical Association, we noted that, oh my gosh, we've got the baby boomers that are in this workforce. They're a third of the workforce, and just projecting out, we knew when they would begin to retire. But then, as we ran our models, we observed, oh my gosh, we're not going to be able to replace them. Our models were very sensitive to the last sort of 5 years of data and that drove a lot of our forecasting. Even though we had 30 years of data, the last 5 really drove it. And what we saw at that time was declining enrollments. 5 years of steadily declining enrollments from 95 to 2000.
Schools.
Yes. And so we said, oh my gosh, that continues. We will not replace these baby boomers, and we will have a shortage. I think we estimated it at 500,000.
Yes, you did.
Yeah.
Yes, you did.
Now, so that was a big wake-up call.
Sure.
And what happened is society reacted. The Johnson & Johnson campaign for nursing's future was probably the biggest. But states developed workforce commissions. The federal government moved on legislation. Other corporations moved in. Sigma Theta Tau, Robert Wood Johnson Foundation. People got nervous and alarmed, and those combined efforts resulted in us now averting this large shortage. Now, we have other problems, but we're not going to have these knockout, devastating Category 5s.
Exactly.
So that's the value of these sort of forecasts to head off what could happen. And the ultimate success is for our projections not to be true, because people reacted and we avoided them.
Excellent. So it really shows the due diligence in the payoff.
It is, and I'm
long
just
term,
happy to be living long enough to actually see some of this happen.
There's your legacy.
Yeah.
So, it's important then, as we sit at this table today and have this conversation. So, what are your lasting words or worries going forward? Obviously, you're going to continue to do this work, but what would be your, if you had a crystal ball, what do you want us to walk away with as we summarize?
I think there's great value in doing national level forecasts. I think they're helpful to identify key variables that matter, and people, it's a good level of information, but it's by far only one part. I think we need much better forecasting at the state level. There's a lot of variation in our country by states. And for example, we published a paper not long ago that showed we broke the nation into 9 regions of the country. Well, we see that in certain regions of the country, your region, for example,
in the
Donna,
Northeast,
is not going to grow their workforce as fast as other regions. I mean, and dramatic. You're talking, I don't know exactly, but maybe 4 or 5% growth over the next 15 years, and you look at other parts of the country, they're going to grow by 40%. Well,
4 times as much.
4 times as much, or more. And so that puts you in some vulnerable situation. Now, I don't know what your demand will be to know whether or not your growth rate will be enough, but I'm concerned about that. The regions around you are not any better. California, the Pacific Coast, again, very, very low growth rates. The middle part of the country, the southern parts of the country, exploding. So these supply forecasts at a national level miss that. So we are trying to do this, and we got it at a region level, but we really need this at the state level as well, both supply and demand. So that's one point. A second concern I have is this lingering uncertainty with healthcare reform makes it very, very difficult for employers and nurse executives to anticipate their future, their workforce needs. And so, they're a good source of information when you say, what do you think you're going to need and for what reason? And many times the answer is, you tell me. They don't know.
Right.
It's impossible. So I'd like to see this uncertainty about health reform get resolved so we can get better sense from the field. The last thing I would say, Donna, is I'm beginning to be feeling much less concerned about the supply and demand forecast. I mean, it's still a concern, but more concerned about what are we producing? What's the quality of the nurse that is being educated in our country? I fear that most undergraduate programs pay only lip service to true quality improvement, the principles, the science, the theory of the quality improvement. And the same thing with economic issues and costs. And we've had this discussion over how many glasses of wine, Donna?
Many.
So we need nurses that come out who understand quality improvement and understand that they are using resources that have a cost. And the real responsibility of nurses is to provide excellent clinical care, aware of how it can get better and how it can be, the cost can be lower. And I don't think we're doing as much of that as I would prefer. So I would rather have a strong nurse in that way than maybe worry so much about supply shortages or surpluses.
Okay. Well, thank you, Peter, for your insights. And we have a moral obligation as academics to ensure that the future nursing workforce deliberates about the importance of quality and safety. After all, at the end of the day, it's all about patient care and patient outcomes. So thank you for the reminder, and we'll have to follow up on that. But certainly this attention and due diligence that you've given us on behalf of the nursing workforce. Thank you and your team and HRSA. We look forward to feedback from our readership and their interpretations of what you've written. There'll be a companion interview with the entire team who participated at this at the deliberations, and certainly this podcast. Thank you so much.
Thank you, Donna.
You're welcome.
The Nursing Economics podcast series is owned and produced by Jannetti Publications, Incorporated. All rights reserved. No portion of this podcast may be used without written permission. Dr. Peter Buerhaus is the Professor of Nursing and Director at the Center for Interdisciplinary Health Workforce Studies, College of Nursing, Montana State University in Bozeman, Montana. Dr. Donna Nickitas is the Executive Officer at the Nursing PhD program at the CUNY Graduate Center, Hunter College, City University of New York, Hunter Bellevue School of Nursing, in New York, New York. For archived episodes of this podcast and to learn more about nursing economics, visit the journal's website at nursingeconomics.net. You can also subscribe to the Nursing Economics podcast on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site, Spreaker, and other various podcast delivery services.